Hello, welcome to What is Osteoporosis? Presented by SumaCare Health Management Services. Osteoporosis is often called a silent disease because one can't feel their bones weakening. Osteoporosis means porous bone. Viewed under a microscope, healthy bone looks like a honeycomb. When osteoporosis develops, the holes and spaces in the honeycomb are much larger. There was a time when people thought osteoporosis was something that happened to everybody when they got old. Fragile bones and a humped back were inevitable. We now know this is not true. Defined osteoporosis is a bone condition that occurs when the body loses too much bone, makes too little bone, or both. This causes the bones to become weak and they may break from a fall, sneezing, or minor bumps. Osteoporotic bones have lost density or mass. As bones become less dense or hollow, they weaken and are more likely to break. This is the typical progression of osteoporosis. About 54 million Americans have osteoporosis and low bone mass. Let's review some warning signs that you may have osteoporosis. Poor, hunched, or slouched posture, brittle bones that break easy or from minimal force. Studies suggest that approximately 1 in 2 females and up to 1 in 4 males age 50 and older will break a bone due to osteoporosis. Females lose up to 20% of their bone density in the 5 to 7 years after menopause. And if your mother or father broke bones as an adult, you may be at risk for osteoporosis. Loss of height, either from the loss of bone or slouched posture, which may be due to stress fractures. Stress fractures are very thin cracks in bones that can occur when the bones are weak and suffer from minimum traumas like falling down or bumping into hard surfaces. And last, back pain caused from easily fractured vertebrae and the curving and weakening of the spine. These symptoms may creep up on you, so it's important that you take easily fractured bones and a change in your posture and height seriously. Breaking a bone is a serious complication of osteoporosis, especially with older adults. Osteoporotic bone breaks are most likely to occur in the spine, the hip, or the wrist, but other bones can break too. In addition to causing permanent pain, osteoporosis can cause other complications. When osteoporosis affects the vertebrae or the bones of the spine, it often leads to a stooped or hunched posture, reducing your height. Osteoporosis may also limit mobility, which often leads to feelings of isolation or depression. Additionally, 20 to almost 30% of senior adults who break a hip statistically die within 1 year from either complications related to the broken bone itself or the surgery to repair it. Approximately 25% of patients will require long-term nursing home care, often as a result of limited mobility. There are some proactive steps you can take before levels get too low. Here are some lifestyle steps you can take in order to fight bone loss. Introduce more protein through protein-rich foods or supplements such as calcium and vitamin D. Discuss supplements with your healthcare provider. Exercise by increasing cardiovascular activities and lifting weights. Both of these types of exercise help to maintain healthy, strong bones. Lose or maintain a healthy weight to help put less stress on your bones. And reduce alcohol consumption. If you consume alcohol regularly and if you smoke, consider quitting. Both of these habits reduce calcium storage levels. Prevention plans vary based on your age and gender, so make an appointment to talk with your healthcare provider to review your prevention options. Large medical and osteoporosis associations around the United States agree that the best way to test for osteoporosis is a DEXA scan. This test evaluates the levels of bone density in various parts of your body. The DEXA scan is painless and gives very accurate readings. A DEXA scan is more accurate than a standard X-ray and emits far less radiation. The scan typically takes less than 15 minutes. All females age 65 years or older should have a bone mineral density screening. Males can also develop osteoporosis and should consider screening at age 70 and older. Females who are younger than 65 years and past menopause should have a BMD screening if they have ever had a bone fracture as an adult due to fragile bones or based on risk factors for osteoporosis. The bone density is commonly measured in the spine, hip, and/or wrist. And after your screening, talk with your healthcare provider about when you should be screened again. How often you should have a BMD screening depends on your age, the results of your previous DEXA scan, and your individual risk of fracture. While osteoporosis may not be noticeable until bones start breaking, it's possible to prevent rapid bone loss and help build strong bones. You may receive calcium and/or vitamin D supplements to help combat the issue that may be causing the bone loss. Females may be prescribed a therapy during menopause due to the loss of specific hormones, mainly estrogen. In these cases, your healthcare provider will tailor your prescription to the severity of mineral or hormone deficiency. There are treatments available for osteoporosis, and the one you and your healthcare provider chooses depends on what is causing the loss of bone. Treatment plans will vary based on your age and gender, not on the severity of the bone density levels alone. Talk with your healthcare provider to review your treatment options. SumaCare resources. Be sure to review your plan documents for access. We encourage you to have a visit with your primary care provider annually. We offer condition and care management programs, health coaching, WebMD Health Manager through Plan Central, 24-hour nurse line, Teledoc Health, smoking cessation, our quick care program, and access to wellness discounts through health and wellness through Husk. Thank you for your time. Here were the resources. And as always, follow SumaCare on any of the social media platforms listed below.